Let me introduce him formally first. The speaker is Professor Dr. INIYAN from Savitha Medical College. He is a professor and HOD of clinics in Department of Psychiatry, Savitha Medical College. He did his MBBS from Kanyakumari Medical College and MD Psychiatry from Stanley Medical College. He is an expert at technology-based innovative teaching learning methodology and research methodology. His areas of interest include anxiety disorders, especially OCD, and is a very active participant in UG and PG academic training programs. He has made this presentation in various academic programs and is currently pursuing his PhD. He has more than 25 publications to his credit. We welcome you, sir. Having said that, he is a very good friend of mine. We did our MD almost in a similar time period in Stanley. He is one person who used to challenge us all to read properly, get more marks, and spread our interest to subjects outside medicine. So in that way, it's a great pleasure to have you with us today. You can please start the presentation, Dr. INIYAN.
Okay, ma'am. Thank you. So, am I audible and am I visible?
Very, very audible.
Yeah, okay. Okay, so I'll start sharing my screen. Okay. So today I will give I have made two apps actually which make research and statistics. I mean the approach to research and statistics easy, and so I'll move on. So the objective of this like session will be first identify what are the issues with someone starting in research. For example, a postgraduate or even a MBBS graduate. Anyone who is starting in research have certain bottlenecks, and where we are sometimes forced to seek the help of a biostatistician or someone from SPM department. So these two apps will help at least limit that dependency. So, and here I have the one app will be focusing on like you are starting with the research question, starting with the first question of forming the research question, and then what next to do, then what next to do. That is how the steps have been framed. So it will first I will give you a brief introduction about what are the core study designs, and then each study design has actually 12 phases of research in this app. I will take one example and show with a psychiatry example and show how we can do that research. And the second part is the Stat Navigator, which this app will help in choosing which statistical test to use for your data. Okay, so as I told you, it addresses two bottlenecks. One is the methodology paralysis. That is, like I'm starting with the research question. Where do I start? Which study design actually fits my question? So the second part is which statistical test do I use? Do I use? I think we know about t-test, chi-square test. So many tests are there. Which test should I use? And how do I calculate sample size? These are all simple questions, but still, this is where when we start research, we just get stuck on this area, and then okay, I have to ask someone's help, or and they may be busy, so it delays the protocols, it delays the research, and sometimes it leads to like frustration or the enthusiasm is gone. So this is where the two apps can really help. So the designing the right study, see if there is a mismatch between the research question and the study, that the manuscript, if you submit, it will be summarily rejected. So that is very important. And this Research Navigator Pro, we will see the study designs. What are the types of study? So it can someone name any studies, any types of study that we do usually in research? When we want to like we have a new drug and we want to test whether it is better against something already there, we do something called any studies, any named any types of study we would have come across in when in like our SPM, or while doing research we'll have this idea of So we have, I think someone would have heard about case control, cohort, randomized control trial, cross-sectional studies. All these are different types of studies. So for my research question, what study should I do? Actually, that is very important, and this is where it will help. So first will be, like, I'll just give you a gist of all the different types of study. So, and we can group them into based on what we are doing in that study. Okay. So first will be interventional study. So intervention means I am doing an intervention. That means that I am doing something to the patient. So it could be a new drug that I'm introducing, new therapy, or anything that is something I'm doing, and it could be some even a relaxation technique. But I'm comparing with some other, usually a placebo or another group, that is called the control group, and we have the experimental group. So these are intervention studies. I'm doing something and following up and seeing whether the whatever I'm doing actually has at least some more benefit. Is there a difference between mine and the actual control? So here the hallmark, we call it as randomized control trial. The hallmark of RCT is randomization. So the core of randomization is, before allotting them to either the control or the experimental group, every person should have an equal chance of getting into each group. So it cannot be like okay, poor, I feel like you go to this group, or feel like go to the control group. So that the process is called randomization. But sometimes, so for example, we can use like MET versus standard counseling for alcohol. So before we are starting the study, we will have the group of patients and we have to decide who will go for which group, and everyone should have equal chance. So this is RCT. Sometimes we may not have the opportunity to randomize. For example, we are implementing some for example, in ER, many cases are coming, and psychiatric cases. We are implementing some new protocol. This is not a new, what to say, therapy, or this is just a new protocol system wide, and we want to say seek the restraint rates. Like before, we have like 100 patients. What was the restraint rate even from those coming to ER? And now what is that? So here we cannot randomize because we already know who has already gone. There is no, that is the control group and this is the experimental group. So this is called as quasi experimental studies. The next, everything is observational only. Where we are not doing any intervention is an observational study. So you have this is what we are just observing, but we can also analyze what is happening. Just because we are observing, it may not be only describing, we are also analyzing. So if you are starting from now and looking forward to the future, that is called as cohort study. For example, I'm looking at people with chronic insomnia. I'm checking, and one group, I'm having people with chronic insomnia, and another group who do not have, and I'm following both groups and checking whether they have more depression compared to this group. So this is a cohort study. I'm following into the future. But some situations, especially in rare diseases, we won't have the liberty to follow. For example, if the prevalence is very less, we cannot. There is no use in following into the future. Even if we follow 10,000 people, sometimes if it's very rare, we may not even get a single case. So in those situations, we do something called case control, where we look back. We start with the disease and see, for example, we can choose like dissociative disorders and go back and see whether they had childhood trauma. So here we start with the disease, like childhood trauma on one hand, and people who do not have childhood trauma, and then go back and see whether what is the prevalence of we have this, I'm so sorry, we have dissociative disorders on one hand and no dissociative disorders on another hand, and then go back and see if they had childhood trauma or not. So that is a case control. But many times what we do for thesis and many other research, generally, if you are not going for an RCT, usually what we'll be doing is a cross-sectional study. But a descriptive cross-sectional study is like, cross-sectional is like a snapshot in time. You're just finding out, like, for example, prevalence of what is the prevalence of comorbid substance disorder in general psychiatry patients, or even what is the prevalence of depression in patient attending diabetic OPD. All these are descriptive, and you're just finding, you're not doing analysis here, but you can also do an analysis that is called as finding association. So this is like, for example, is higher daily screen time associated with higher anxiety scores. So this is, you are not following up into the future, you are not looking back, you are doing both at the same time. You are measuring, maybe for screen time, you are measuring the hours of screen time, and you are measuring HAM-A scores. You are comparing both. So if we are finding association. This is an analytical cross-sectional study. You have something called see, these are observation studies. So you have other studies called diagnostic accuracy study. This is only solely for testing a new either a screening tool or an investigation. From ours, it could be a screening tool. So you are using like a new screening tool against HAM-D, like that. So for the this is called as diagnostic accuracy study. It finds sensitivity and specificity. If you are looking at just describing a group of patients with similar illness, that is called as a case series. For example, in our hospital, we had many cases of NMDR and encephalitis presenting with psychosis. So that was actually quite rare, and so we presented a case series because we had 6-7 cases, and we presented as a case series. A case report is a single case that is exceptionally unusual or very rare, and only then it will be accepted. If you a normal case, I'm presenting someone presenting with EPS, that is not significant enough to get published. It is a normal usual case. So something like aripiprazole usually doesn't induce NMS. So if you are you are seeing a case, then that could be a case report. In fact, this was in IJP, one case report in IJP. And so there are other studies. Qualitative research is like it doesn't quantify, it just tells. For example, you are looking at interview like residents, interns, or even PGs, whether burnout rates you are checking. Burnout not rates, burnout experiences. Like, what are you feeling? I'm sad, I'm angry. One person is noting like this, one person is telling I'm depressed. Whatever they are telling, we can just take it, and there is no you are not quantifying it. So that is called as qualitative research. And it can be any, like cancer patients experience on their like how they are dealing with the crisis, anything just which just doesn't have any scales, tools, any, or even investigations. These are all qualitative. And scoping review is something like I think there is something called systematic review, and I think you may have not heard about it. Systematic review and meta-analysis, which are quite complicated for a beginner to do. So, but you want to map the existing literature, you can do something called scoping review, which is something like an extended review of literature that we usually do. Okay, so that is called a scoping review. So now I'll just show the app. So this is the app. The link, I think, driniyan.com/research. You can just open it and check. It is a free tool, and you can see. If you go here, I don't know what to do. If you don't know what to do, it will guide you to the steps. First, if you scroll down and see, I don't know what to do, you will ask the question. So, are you testing an intervention? Is like a drug or a treatment or procedure, whatever. So if the answer is yes, it is an intervention study. If the answer is no, you are doing an observational study. If it is an intervention study, can you randomize? Can you randomly assign participants? It is an RCT. If you cannot randomize, it is quasi-experimental, which we have already seen. I'm just telling how the app will help. So yes, then the next question, if it is no, I'm not doing any intervention, I'm just naturally observing what naturally happens, is a observational study. So here you can have, like, if you are studying a rare disease, it is a case control study. Or are you going to follow people over time, then it is a cohort study. And suppose snapshot on time, I'm not going to follow up, I'm not going to look back, at the same time I'm doing, that is a cross-sectional study. I just want to test a diagnosis or an investigation against a gold standard, that is a diagnostic accuracy study. So you just describing patients, you are not comparing, you are not doing much analysis at all. So if it's the many patients with same condition, it is a case series. If it is a single interesting patient, case report. Sometimes even case series do have some sort of an analysis, even we can do, but that's not a mandatory. But we cannot blindly say that there is no comparison at all. And mapping existing literature, as I told you, the gold standard is systematic review, but you can also do something called a scoping review. And you are just exploring experiences, it is called as qualitative research. Okay, so this is how the app can help choose the study design. The next is each study design, if you choose, it will have 12 phases, like starting with the research question and to the final publication. So the research question is like, for example, are people who are watching mobile more depressed? Okay, this is a research question. So like that, whatever, you should be able to frame your research question in one sentence. So that is the initial phases. I will explain that with an example, but initially the app will cover the first three phases, which will have question framework. For example, title. If you are doing an RCT, it should have PICO format. Anyone know what is? Any idea? PICO format. It is a mnemonic for population, intervention, comparison, and outcome. See, even in our when we submit to our SRB scientific report, they wouldn't accept any title for thesis or any publication if it is not in PICO format. If it is an RCT, or if you are doing for any observational, it will be in PECO format, which is called as population exposure. There is no comparison and outcome. So this is the format for observational studies. So we have certain rules for every phase of our research. And literature review also I will explore. For RCTs, CTRA registration. CTRA is Clinical Trial Registry of India. It is absolutely mandatory that you have to do a CTRA registration. And informed consent also is necessary. So these will cover. I'll just rush through here and I'll explain more in there. Phases 4 to 6 will be designing the engine, that is the operational definitions of the different variables. You cannot say just a depression. You have to say meeting the diagnostic criteria, DSM-5 criteria of depression, or ICD-10 or ICD-11. You should mention specifically. And you cannot say if you say hypertension, you should mention exactly what you mean by how much should the systolic be, how much should the diastolic be. Then that only shows it is hypertension. You cannot just mention vaguely. So that is operational definition. And sampling method and all I will explain more in that. Then the last two phases, the 7 to 9 will be sample size, data collection, what you can do, data management, all this we will explore. Finally, how to actually write to the journal, how to prepare the manuscript. IMRAD format is introduction, methodology, results, and discussion. This format is generally followed. So I will also give a brief about the statistics, basics of statistics. Then I will choose one scenario for a PG level study, and then I will go through all the phases. Okay, so softwares like SPSS will require you to know what you are, like for example, which study you have to do. If you know that you have to do a t-test, it will help you. Yes, but I don't know what study should I do for my own data. Should I do a t-test? Should I do a chi-square test or something, correlation? What should I do? If I don't know, that is where this app will help. Okay, and yeah. So here, very basic of research, data can be divided into two, numerical and categorical. Any idea example of a numerical data? So a numerical data is like what can be measured. You can measure it like age, height, weight, BP, HAM-D score, HAM-A score, anything which can be measured is a numerical data. And a categorical data is something that we cannot measure, which you can put into buckets, but you cannot measure. That is called as categorical. Example, gender, you cannot measure. You can say male, female, or you cannot, even if you are, for example, depression severity, if you are measuring HAM-D scores, that is a numerical data. If you are measuring depression severity, like mild, moderate, severe, that becomes a categorical data. So gender, disease status, severity, all this. And whenever we are doing research, we have something called assumptions. So we generally assume our data follows a normality, or it follows a bell curve when plotted. but sometimes because of some extreme data we do have skewing of data. For that the separate tests are separate. Okay, even this also the app will help, like whether the data is normal or not, how do you check? A very simple trick is to like if in your data, if the mean, median and mode are almost the same, then it is a normally distributed data. If they are very different, then your data is skewed. So these are the four things that you should know when you are doing, like when you are going to do statistics. We will cover the research part, yes, but statistics, I'm going to choose a test. So you want to compare two averages, like for example, HAM-D scores in escitalopram versus placebo, or even BP measurement with a new drug versus say so AC inhibitors or some like that. So here you are comparing two averages. So what test is ideal? Any idea? You are comparing two averages and they don't have any relation to other. If you are doing in the same patient before and after the test, that is different. But here you are doing in two different groups. Any idea of what test you will do for comparing two averages? So you will do a independent t-test. This is assuming your data is normal. If your data is abnormal, skewed, it doesn't follow normality, non-parametric test, you do a Mann-Whitney U test. Okay. So suppose if you are comparing three averages, okay, like HAM-A scores are for first year, second year and third year PGs. Any idea of the test? So this is called as ANOVA. So you do ANOVA. If of course everything the plan B means if it is not following a normal distribution, you go for something called Kruskal-Wallis test. So this is the next thing. If you are comparing categories, yes, no. For example, relapse rates in patients who are adherent, non-adherent. So you will have like a table. Relapse rate, yes, no. Adherence, yes, no. So if you are comparing this is called as the test you use is chi-square test, and of course if it's not following normality, it is Fisher's exact test. Not exactly okay. So the next thing is you are finding a relationship. Sometimes this also is very important. For example, you are finding whether, as I told you, whether people who use Instagram more are getting more anxiety like that. So you are using the number of hours of Instagram and say compare it with the HAM-A scores. So if there is a relationship between the two, for this you use something called Pearson's correlation. And of course, the next thing, if it is not parametric, you use Spearman's correlation. So this is a basic introduction about the research. Yeah. So next will be, I will take a sample, like a scenario for a psychiatry PG, like a thesis or even at least a publication. So a PG in the psychiatry OP notices that the patients presenting with severe anxiety seem to consume more coffee. So he want to do a snapshot and see if daily caffeine intake is directly correlated with higher scores on Hamilton anxiety scale. So this is the scenario. Okay, so in this, so here, what is this? Any idea? What is the test that we should do? Please, it can be. So you have to. So it depends on what my parameters are. Yes, if you are telling like yes, the person you can have it two ways. One is, do you drink coffee or not? Do you yes, no, and you are suppose comparing you are using ICD-10 criteria for anxiety and then telling yes, no, then you go for a chi-square. But generally, I don't think there will be there will be much people who don't drink coffee. So in that aspect, you have to quantify the data. So you have go for a average every day, how many average grams of coffee they are drinking per day. That you can get from the how much cups they are drinking. So in that case, one parameter is average number of grams of coffee they are drinking. And here we are not using ICD are telling that yes, no, anxiety is not there or not. We are using Hamilton rating scale for anxiety. Then what would you use? Here is here it is a okay. So first, for example, so we will go with this. So are you doing an intervention or not for the study? You can reply in the can or all mics muted or not? No. No. So there is no intervention, right? There is no intervention. You are not doing it. You are not giving coffee to them. They are drinking. You're just going to observe. Are you like going back into something like have or are you going back and looking back? No, you are just doing now. You are at the for example, I'm just looking at the same time one patient. I'm just getting into my OP. At the same time, I will ask, okay, how many coffee cups you are had? Okay, this many grams per day. Okay, I'll give you a Hamay scale at the same time. So I get at the same time snapshot. I get both the coffee average as well as the Hamay score. So this is what type of study you are getting both. It is an observational study. You are not doing an intervention. You are not going back. You are not looking forward. At the snapshot, what type of study? So this is a cross-sectional study. So it is an observational study in that it is a cross-sectional study. Okay, so you do a sorry. Cross-sectional study is like yeah. So what is the research question is that is here are people who are very simple, are people who are drinking more coffee having more anxiety? That is a very simple research question. So here the population is people who are drinking coffee. Sorry. So people who are the population is the people who come to your OP, and people exposure is people who are drinking coffee. The outcome will be Hamay scores. People who are drinking coffee is like the average coffee grams per day, that will be the exposure, and the outcome will be the Hamay scores. In as I told you, in PECO format observation studies, there is no comparison group. You are not doing an intervention, so there is no comparison group. And anyone can anyone say what is null hypothesis or like any idea of null hypothesis? So generally, when you are telling that you want to say whether people who are drinking more coffee have more anxiety, you presume that yes, there is a significant association between coffee drinking and anxiety. That is your that is your premise, your idea. So whatever you are hoping or whatever you are thinking, that is the alternative hypothesis. So there is a significant association between average grams of coffee intake per day and the Hamay scores. That is your alternative hypothesis. So the null hypothesis just flips the script and it says that there is no difference between coffee intake and the average grams of coffee per day and the anxiety scores. So that is the null hypothesis. So this is null hypothesis and alternative hypothesis. Every step in this app gives you the checklist for all like whatever you are supposed to do. You can follow that. So the next step is literature review. Literature review is like it is for whatever you have already, whatever research is already there in your topic. What if exactly whatever you are trying to prove has already been proven multiple times? Then there is no novelty in your research. So in that aspect, we have to go through the literature review and see. So these are the sources of literature review. The most common source is PubMed. Google Scholar is also accepted. Cochrane Library is only mainly for systematic review. So generally we focus on PubMed. And when we are using PubMed, we use these mesh terms, which because we cannot say we have to choose other things also. Some studies they would have quoted as even this anxiety symptoms, anxiety disorder, or they would have said just anxiety. So all this also should different variations should be included. So if you want to include more variations, you should use these are called Boolean operators. You should use something called R, so that and means it will use only if it matches in the same like title or you're searching. If it has both your, for example, coffee is one mesh term or some one term, and you are using anxiety, it will search for all the articles which have both coffee as well as anxiety in their title. Okay, so and narrows down or usually broadens. So you can use both depending on the situation, not excludes. Okay, and for organizing your references, no, I would suggest, I have used Zotero, even as Dr. Vanishri ma'am was telling, no, we were doing our own research 10 years back, when in 2014 also we all did. I'm proud to say that our batch of PGs, we did our own research. So we used something called Zotero. That is a very useful software. It has even a Chrome extension. It has a Word extension. Inside Word document also Zotero will come. So anytime you see any reference, you can just click and then it will come. And finally, you can just click something called bibliography. All the references will come one by one, whatever format, Vancouver format, Chicago style, whatever you want, it will come like that. So Zotero is useful, and the Mendeley EndNote are also useful, but I have not used it personally. Finally, in this also, there is something called need for study. Why should I do the study if everything is done? So you have to justify that also. The need for study is like, suppose this is most done in Western population, it's not much done in Indian population, or this particular cultural group. Anything you can to justify why you need to do the study. Same like similar checklist. Next is IEC approval. So ethics committee approval is extremely important for any interventions. Okay, so that is extremely important, but generally speaking, even for like cross-sectional studies also, sometimes some journals do expect an ethical committee approval. And here you have to get informed consent from your patients always. Sometimes if you are doing a case control, most naturally you cannot go back and call and get the consent. Generally case control you generally don't need. And data confidentiality, if you are putting wherever, you have to give codes rather than names. Then the study design, actually. So here we are doing a analytical study. We are not going to just, we will be describing certain things, but also we will be doing mostly an analytical study. So you have to have the operational definitions. That is why I told. So you cannot say a vague terms. You always have hypertension means the systolic BP should be more than 140, diastolic BP should be more than 90 or something like that. Smoking means what the current means, it should be more than one cigarette, or you should define what do you mean by each term. Okay, you cannot just say coffee drinking. That means who do you say? What is the average grams? All this should be particularly made clear. So that is called as operational definitions. Then you have to classify your data. Here we told our data is mostly of continuous quantitative data. So similarly, checklist. Sampling is like, you want to say, for example, here I just want to see people who drink coffee have the higher level, depending on their amount of coffee intake, whether there is a correlation with Hamilton scores. So but you cannot ideally your whole population is who all drink coffee, but you cannot get everybody. That is why we take a simple sample out of it. For this is the sample. The target population is the entire group. Study population is who you can statistically reach. Okay, whoever is attending your OP is your study population, and actual participants enrolled is your sample. Okay, and you should have very strict inclusion and exclusion criteria depending on your study. So here sampling, you have two sampling, something called probability sampling and non-probability. For most of our studies generally that we do, we have usually used non-probability, because we cannot, like, if ideally I have to do simple random sampling, I should get all the people who drink coffee and able to randomize them and choose 200. If my sample size is 200, I should be able to get 200 out of that, but it's not possible. So we use something called consecutive sampling. I just take people who ever come to my OP. Usually that is what is done generally for most of our studies, consecutive sampling. Then sample size. Sample size also is very important. We should know how to have an idea about sample size. Of course, there are complex calculators. but I will just show you what the stat navigator does. Here there is something called sample size. You can check in the app. Here sample size. So if you click here, we want to see correlation. We want to compare with the average number of coffee grams of coffee with your Hamming score. So correlation. Here, if you click, we expect a moderate correlation. See, how do we know what is the probable relation between before doing a study? It is just a guesswork. But if you want to be more thorough, you have to do either a pilot study or look up previous research. So this is the moderate correlation we are expecting. Power of the study is like sensitivity. Like it will find out people who have if whether the correlation is true or not, it will find out. This is alpha is like specificity. How much error can we tolerate? That is the alpha. So if you, for example, if you calculate, it will show 85 pairs. That means for this study about coffee and AHAMA, we need 85 pairs. That is one arm 85 and another arm 85. So this is how this app can help. So next is checklist as usual. Data collection. So once you have chosen what to do, you have to choose the questionnaires properly. Should I use HAMI or should I use any other rating scale for anxiety? Coffee, how do I measure it? You should define it and you should stick with that. Okay, so that is what choosing your instrument means. And ideally, pilot testing should be done for most research, but sometimes it is not feasible. Data management is important. Generally, what we all do, we will just put everything into Excel and then or use Google Sheets. It's fine. It's not wrong. But if it crosses too many subjects, if you're doing an extensive research like 1,000 people, an Excel is not the ideal data management system. We have something called RedCap, which is a free online tool, which is essentially made only for this. So you can use that if your database is too big. Data coding, this you will know if you have done SPSS research. You will have like male is equal to 1. That is how it will, you have to, even SPSS, there is a area called variable where you can actually define, okay, here for this parameter of gender, male is equal to 1, female is equal to 2. So your data will actually have everything in that format. In this, for example, some patient say 25th patient, his gender is, if he is a male, it will be like 1 in that cell. So this is called data coding. And data cleaning is like, suppose there are some errors like age, suppose you have noted, or BP, it is something is wrong. First, what we should do is you should go back to the original source and then recheck. If that is also wrong, then we should not delete the whole patient. That if you are doing that just because one data is wrong, you are sabotaging your own research. You should just remove that particular cell. For BP is wrong means that BP alone you remove. SPSS will understand. It will know what that missing data means. It is not there. It will understand and do the statistics accordingly. So again, checklist you can check. Statistical analysis, as I told you, every study should have both descriptive statistics like mean, median, frequent mode or frequency. All these things should be there. But here what we are more interested is the inferential statistics. So that means that is the hallmark of the core of your research. Whether this is linked to this or not, I want to know. So here what type of here, this is how Stat Navigator can help. Here you go. What type of data is this? Categorical or numerical? Average grams of coffee versus HAMA scores. Both are numerical data. And I want to compare two groups. I want to compare groups and they are not paired group. It's not the same subject, two different subjects. So I have to compare two independent groups. So here is the problem, whether normal or not. If you are not sure, histogram, is it a bell curve? These are some techniques. As I told you, another simple technique is mean, median, mode or similar. So if it is, yes, it is a peer independent t-test. Okay, so sorry, 1 minute. I'm really sorry. I went further. Sorry, we do not want to form comparing the group. We want to do correlation. So we want to check whether the two groups that is one, the patients with patients with coffee average grams, is it really correlated with HAM-A scores? So here we want to say normal or not. Again, it is same thing. And if it is abnormal, we go for, if it is not fitting, we go for this. If it is fitting, we have something called Pearson's correlation. So your correlation is like, I have two people, two things, whether they are related or not. So if you want to have, for example, you are doing an RCT, I have a drug like a new drug like cariprazine, or comparing it to haloperidol. I'm just checking the average reduction in say PAN scores or some rating scale for psychosis. If you are comparing those two groups, in that situation, you go for something called same thing, numerical. There you will be comparing. If you are doing an RCT, you will be comparing two independent groups, and there you will be doing an independent t-test. But if it's a cross-sectional study, if you are doing like, I want to see the association between two things, then you will go usually for a correlation. And here, if it is normal, you go for a Pearson's correlation. If it is not, then Pearson's score. So this is the test. This is the test you have to put into the SPSS. So what happens here is, you should understand always, correlation is not causation. That doesn't mean that people who drink coffee are more anxious. It could be the other way around also. People who are more anxious could be drinking more coffee also. So it never, you cannot assume some things are associated, this is causing this. For example, if you see the this typical example is given us in during summer season. If you take the general statistics, generally there is a higher incidence of drowning. Okay, so the prevalence of drowning is high. If you take the sales of ice creams, sale of ice cream is also quite high in summer. So if you take the ratio or average here, it will show, if you put a correlation between both, it will show a positive correlation. That doesn't mean that people who are taking more ice cream are drowning, or the vice versa. So that usually correlation does not, it never indicates causation. If you want to prove causation, you have to do either a RCT. The gold standard of proving causation is RCT. So if you want to prove this, you have to take people who are drinking coffee on the one hand, who are not at all drinking, and then follow them up, and then see the prevalence or the HAM-A scores later on at a particular cutoff date, like 3 months or like 1 year, like something like that. Then that is an RCT. Then that definitely proves. Okay, so for proving something that is causation, you have to do an RCT. Otherwise, we can just say these two things are related. Okay, so next thing is, we have done the idea. We got that I should do a Pearson's correlation. Then SPSS is useful. Of course, recently something called graph-pad prism also many postgraduates are using. The next thing is reporting. Have anyone heard of reporting guidelines? So I think journal clubs, this is what we generally do. Whether a journal article had followed the specific guidelines. For all cross-sectional studies, the guideline is called STROBE. If you go to say similarly for what to say RCT, it is called as consort. So if you come to that area in an RCT, it will be called consort. So like this is how the app differs from each study. So every phase will be different from each other depending on the nature of the study that you are choosing. Yeah, so like RCT, it is showing consort. For this observational study, cross-sectional, it is STROBE criteria. So it will give you like idea about how the study should be designed, whether limitations were given, whatever. It is like critically appraising your own article before submitting to a journal. And so how the tables and figures should be there, all these things, there are guidelines. And you should always try to report exact p-values. And there is something called p-hacking. That is what PGs will do is, sir, I'm trying to find out correlation. See, your main study, in this study, I'm trying to have coffee average grams of coffee per day versus Hamilton rating scale A, and I'm trying to see correlation. I've given Pearson's correlation, but it's not coming very significant. It's not showing any statistical significance. P value is less than is not less than 0.05. It is somewhere like 0.1 or something like that. So that means there is no strong association between coffee drinking and anxiety. But the what will happen? PGs or anyone doing research will be panicking. Okay, there is nothing, no positive I'm giving, no statistical significance I'm giving. We'll put some other data together. There's something which is not related to your study itself. They'll put something and some related finding. Okay, Hamilton is and some other. It may be related to some age or some. I'll compare both, and Hamilton rating I will compare with some other parameter and say that, oh yes, these are the areas I got p value more than less than 0.05. But that is called p hacking, trying to find out which two data gives you 0.05 or less, and then trying to prove this should not be done. So even a negative like result is a result. It's a very significant result. Something is it tells that there is no correlation is also very significant. That is what we should know. And again, the phase 1, phase 11 research checklist, you have different like the whatever you have discussed, flow diagram, all the tables, all this should be discussed finally. And finally, when we are doing the study, IMRAD structure is the same thing: introduction, methods, results, and discussion. So here, the title and abstract, it should again, it should try to follow what we called initially PECO format, and it should mention what type of study it is. It is a cross-sectional study. It is a observation. It is a descriptive study, or it is a randomized control trial, single blinded randomized control trial, double blinded. So all this will be should be mentioned in the title itself. Then introduction, all this it should not be too like it should be like 3 to 4 paragraphs, not too much, and not too long. And the methods, whatever we have, so ideally, generally doing research, many journals ask for something called a flow chart, like what happens to your patient once they come into. And you should also address ethical concerns. What do you should address? For example, you can say, in my college students, I did some study, prevalence of depression, and you say that 30% were depressed. That's all. What did you do for those patients? What did for those students? So that is an ethical issue that should be addressed. You cannot just do, I'm happy with myself, I just let them be happy with their depression. No, you should address that part also. That is the ethical part. So many journals require, and the ethical committee will also be focused on this. So you should note everything that is we have focused on during the methodology part should be mentioned here clearly. Results, yes, it should table should be clearly mentioned, and result should not discuss your finding. Result should be without any emotions, or it should not have any. There should be neutrality. It should just generate facts. It should not. So I feel because of this, this is more related to this. No, not like that. You just show what is the correlation, what is the values. You should say the p values, all these things, but it should not say other things. That is the discussion part. Discussion, of course, you bring some existing literature. First, you will, of course, mention about what are your findings, but you also compare it to the existing literature. Here, another important part that we should focus is limitations. So limitations, we have to know, we can get by peer review before it submit to a journal. You can give it to some other person who is good at research and say that, yes, we are find some limitations in my study, I'm not able to find. So that will really help. And the future directions are also quite important. Generally, we can in the discussion part also we can say conclusion. Conclusion, you should not be over enthusiastic and say, yes, coffee drinking is causing anxiety among. Not like that. You have just found out association. So there is a coffee drinking is strongly associated with anxiety in patients attending psychiatry OPD, or anything like that. You cannot overstate your finding. Second thing is, it should not be too long also. It should be just a one paragraph, never more than one paragraph unless absolutely necessary. maximum 2 or 3 sentences. So choosing a journal, that is a different topic on its own, and it's like the you main thing is avoid predatory journals. There are journals which will say I will get it published in 2 days, give me 10,000 rupees, everything. It will be published, but the whole journal itself will be removed from your ideal indexing, like Scopus. And there is a chance, if you keep on doing this and Scopus notes that this person is notorious for submitting all this for not so good journals or something like that, there is a risk of black marking your name. So we should be very careful in avoiding all this predatory journals. And another thing is, we should also not ask the statistician to manipulate the data, whatever data is coming, because they will offer, yes, see, sir, there is no p value is not coming, significance is not coming, I can edit the data and do that. Should not be done. So usually after submission it takes time, so that is what you cannot have a like express publication. If somebody, these words are generally there, you should be very guarded. Some journals putting express publication in 2-3 days, acceptance in 2-3 days. Usually peer review, if they are doing properly, it will take weeks, at least a month, for proper, at least saying that we are going to accept, or at least minor corrections, minor revisions, major revisions, or rejection. All these things they will tell within say 2 months. So finally, we have come to the like this study. We have taken a scenario and then come to the final publication. So after you do that, you can start over. Okay, so this is how you use the app. It will help you guide through the different stages. And the other app, which is the statistics app, so this will help you in the finding which statistical test. It's also sometimes complicated, but this is which we don't use. Like pharmacology, they may use this, and SPM, they may use this. There's something like, but generally what we will be focused on is, you will be comparing either categorical, where you will find association, all these things. So case control, everything, it will give you whatever is most important. For example, for a case control, odds ratio is important. For a cohort, relative risk is important. So that also will be there. Cohort relative risk is important. All this you will get from the app. So yeah. So finally, these are the links: drinian.com/research and drinian.com/statsnav. It is free, and you just need internet to first connect, and then once it's connected, I think even without net it will function. And I mean, I would like to acknowledge people who helped me prepare the app: Dr. Subhashni from our department in Savita Medical College, and Dr. Bhuvanesh from another department, SPM department. So now I'm open to questions or any doubts, clarifications.
Yes, other participants, kindly put forward your doubts or questions, or please, if you have any suggestions also, sir will be open to your remarks and feedback. If you have started using the app, you can tell us how easy it was to use the app also.
So you can use the app and see how it will be helpful. If you have doubts also, you can later on you can use and then put forth your questions. I will share my email ID. Any doubts?
Actually, it was, I will share my experience. I mean, listening to you only, it looked like all the messages were hitting close to home. Don't skew the data, don't delete the data, don't influence the researcher, don't influence the statistician. All these are temptations which very frequently we are pushed towards.
Yes.
When listening from you, it looked. It was very relevant. Thank you so much for sharing.
Thank you, ma'am.
Almost like a hands-on experience we had, workshop experience we had here.
Actually, the app, even for a RCT, I didn't choose an RCT because it's not common in here in Savita. We are mandated to every PG should be doing a randomized control trial, and it should be an application or a product that they develop. That is the dictum here in Savita Medical College. So they will develop an app or some product. If it's surgery department, they will develop a new type of scalpel or new type of catheter or something, and then they will use an RCT to prove how it is better than the existing. So RCT is even more like there are many more steps like something called allocation consignment blinding. All these things will be there in RCT. I didn't cover that, but the app covers that also. If you are doing an RCT from scratch, it will be really helpful from the beginning to the end, actually.
Thank you so much for sharing.
Thank you,
Thank
ma'am.
you so much for giving us your time this afternoon or weekend afternoon. You have
Yes,
allotted
yes.
for us. Thank you so much.
Thank you, ma'am. Thank you, ma'am.
I think we can close the meeting then.
Yes, ma'am. Yes, ma'am.
Thank you all.